What was the diagnosis for you?
The diagnosis was that there was a buildup of calcium around the aortic valve, which prevented it from opening fully and supplying enough refreshed, oxygenated blood to my body.
I want to turn to you, Dr. Ahmed. Help us understand, educate us as to how the valves work in the heart. Where are they and what are they doing?
You know, the valves in the heart are like any normal mechanical system has valves to keep blood flowing in one direction and to stop blood leaking back in the wrong direction. So every time the heart pumps, it pumps into these vessels so it can supply the body, for example, on the left-hand side, or on the right-hand side, the lungs. When the blood is pumped, in order that it stays forward and doesn't come back inside the heart, there's valves that basically stop and it stops the leak. So there's two valves on the left side of the heart, known as the mitral valve and the aortic valve. On the right side of the heart, there's the tricuspid valve and the pulmonic valve. And those four valves are the main four valves that we kind of know about and treat over time. And dysfunction in any of those valves, whether that's getting tight in a process known as stenosis, or whether leaky in a process known as regurgitation, those dysfunctions can lead to symptoms such as heart failure, shortness of breath and fatigue, and then it can have worse consequences if not treated and diagnosed appropriately.
So the two things that go wrong is that you call it regurgitate or leaky, I guess, and then the other one is like a buildup. Is it a calcium or what we know as stenosis?
Yes, so stenosis, the most common cause of stenosis and the most common reason for stenosis is aging. And like with any joint or any other thing in the body where you get wear and tear over the years from buildup of calcium or other things, the valves in the heart can build up calcium, and that causes a tightening called stenosis. And almost it becomes like a door that becomes creaky and harder to open and harder to close and less soft, and that can result in an area going from like that big that the heart would go across down to something like that when the stenosis becomes severe. Now, there are other causes of stenosis. People can be born with conditions that are congenital, and that can predispose to stenosis. In the aortic valve, for example, some people can be born with 2 instead of the 3 normal leaflets, and that can predispose to wear and tear over time. And then other conditions such as radiation, maybe certain medicines, or other unknown reasons why it could happen.